record a podcast. And we're back with Your Natural Dog. I'm Angela Ardolino, and I've got my very favorite holistic veterinarian. And I just want to know, one time you said, I bet you say that to everybody. And I'm like, yeah, I got like a list of 10. I think it's gone down to 5. And yes, you are my favorite. So I just want to clarify that from the beginning. Dr. Judy Morgan. And yeah, I feel like I want to have a rant with you because I just feel like we take 3 steps forward and fall 2 steps back because people go, oh, hey, people are really into this natural, holistic way. How do we get in on this? I mean, I know it's called greenwashing, but they literally are coming into the holistic space and everything looks right. And then you read the inactive ingredients or something like natural flavorings is on that label. And you're like, nope, we know better what is that? So we're going to rant today about some of these things. I wanted to start with antibiotics because they are still, and I'm pretty sure I pulled this off of your beautiful blog on is your veterinarian overprescribing antibiotics? But the AVMA Task Force on Antimicrobial Stewardship, man, that sounds important, has said that inappropriate antibiotic use in pets may be as widespread as human medicine. And in human medicine, it's estimated up to 50% of antibiotic prescriptions are unnecessary. You agree with that?
I absolutely. And I have so many examples where this is just, so people have heard me tell this one before, but 4 years ago, my mom was in the hospital for a month for a bowel obstruction. And she was released after surgery, was released from the hospital, sent home. She wasn't doing any better. We went back. We're in the emergency room. It's like, showed up at 9 o'clock at night. By 3 o'clock in the morning, we still haven't seen a doctor. And a nurse came in to hang 3 bags on her IV pole. And I said, what are those? And she said, these are the antibiotics prescribed by the doctor. And I said, what doctor? We haven't seen a doctor. And she said, oh, the doctor looked at the chart. I said, the doctor looked at the chart and not the patient? And I said, what are the 3 antibiotics? And she told me, and I said, oh, am I allowed to swear?
Absolutely. Come on, it's my podcast, Judy. Of course we're allowed to swear.
I said, hell no. And I chased her out of the room. The poor nurse, she was like, I'm just doing my job, what I'm told. And I'm like, yeah, well, I'm taking care of the lady in the bed. So, because apparently you people aren't. Chased her out. And I said, we will talk about that when a doctor comes in and actually examines the patient and has a conversation with me, the person in charge of medical decisions for this patient. And so finally this, resident, very young. And I know I'm getting old when I look at professionals and go, oh my God, they're still wet behind the ears. But she came in and I said, you haven't even examined your patient. Well, I read the record. And I said, that doesn't tell you anything. You don't know who this is. And, this has been going on for 3 weeks. And I said, do you know the side effects of those 3 antibiotics that you want to give my mother? And she goes, well, no, not necessarily. And I said, you mean to tell me you don't even know the side effects of the things that you want to give to she was like 85 at the time, to an 85-year-old patient? And I said, well, I'm going to say no until you open up your little phone and you look up every one of those drugs and the side effects and you read them to me. Because I knew the side effects of all of them, which is pretty sad that a not real doctor, because that's what they call us, a not real doctor knew and the real doctor didn't. So after she got done reading them to me, I said, would you give those to your mother? Thinking that, we could end up with C. diff. We could end up with a lot worse problems. And we don't even know that we have a bacterial problem to begin with. So we ended up I ended up letting them hang the metronidazole because I knew that was a good anti-inflammatory for the bowel, in addition to being an anti-protozoal and antibiotic. And I said, of the 3 that they had, because the other 2 were major, like kill everything drugs.
And they don't even know what happens when you put those 3 together.
Exactly. So
and all the other ingredients and those 3.
So we settled on one and, she miraculously was much, much better with just the one. And then when they finally got all the test results and figured out that the problem was ulceration in her lower bowel that had caused the adhesions that caused the obstruction, it was like, oh, well, that would be all the ibuprofen that everyone has prescribed for her still causing a problem. So, it was just like, one thing on top of another on top of another. So that's my human story, which, this is why we all have to have an advocate who knows something that can stand up for us. So one of my cats last fall, deathly ill. One of my barn cats, temperature of 104.5. He's flat out in the greenhouse, didn't want to eat in the morning. And he's our biggest guy, Harry. And so I'm like, okay, Harry, you're going in the house. You're going in isolation. Took his temperature was 104.5. And I'm like, okay, we're going to go get lab work. So we go get lab work. My vet's great. She gets me right in. Go in. We get lab work. We get him some fluids. They have the lab work immediately. And his white blood cell count is literally bottomed out. He has like a white cell count of 1,000. So like no white cells running around. And I'm like, okay, it's viral. Just needed to know it's viral. The rest of his lab work was fine. And so it was not my regular vet. It was one of the younger vets. Again, looking like a high schooler. So I've got this younger vet and she says, well, I think we should put him on some non-steroidal anti-inflammatory to bring his temperature down because cats, if they don't eat for 3 days, they can go into fatty liver syndrome. So I'm like, yeah, this is one of those times when I'm like, I really need something to bring this cat's temperature down. So I'm going to okay that. So we gave him an injection. We gave him some sub-Q fluids. And she said, yeah, and I'm going to prescribe antibiotics. And I said, we just determined that this is a viral infection. What are the antibiotics for? And she said, well, his white cell count's so low, he's like wide open to infection. And I said, but antibiotics don't prevent infection. So if he breaks with a bacterial problem, then we'll figure out where the problem is. I mean, do we have snot coming out the nose? Are we coughing up something? Like, is it respiratory? Is it GI? Like, I need to have an idea of what I'm treating before I just willy-nilly grab something off the shelf. So I said, I'm just going to say no to the antibiotics. So I said no to the antibiotics. And about 4 days later, the cat started to eat finally, and he did great and he recovered and it's no problem. So then I have a dog, Gabby, my little redhead. Mm-hmm. She was eating a cookie. We were trying out recipes, and it was a coconut flour cookie, and it was very dry. And she's brachycephalic, so she snorted it into her sinuses. And she's coughing and choking and, the whole 9 yards. So we got that cleared up. And then for like 3 weeks after that, every once in a while she was eating, she would suddenly back off and kind of do the snorky thing and then run in the other room and quit eating. And then she'd go outside, run around and sneeze out big gobs of clear and white stuff. And I'm like, oh man, she's still got cookie in her sinus. So I take her in.
A neti pot on her.
Right, exactly. Because that's what I was thinking. Like, I just want to flush her sinuses.
Yeah.
So really hard to do on those brachycephalics.
I know,
so,
I'm sure.
Again, I take her in the vet. Again, I get the younger vet, not my traditional vet. So I said, look, I just want to do lab work. I just want to make sure that there's nothing else going on. I want a chest x-ray because she has a murmur. I want to make sure we're not having a heart issue. And so we go through all that. Her lab work's perfectly fine. Her heart's a little enlarged. I'm like, fine, I'll make a cardiology appointment. And she goes, okay, well, I think we should put her on antibiotics. I said, for what? She says, well, she's got this nasal discharge. I said, it's clear. And sometimes it has a little gray tinge. Like, it's not a bacterial problem.
It's like they want to always stop the body from doing what it is. Everything's standard of care. So they just look over and antibiotics is listed on everything.
Well, and part of the problem is, and I saw this in practice too, a client comes in with an animal that has a problem. They're a sick animal. The client wants to walk out with something in their hands to treat the animal. It's making the client feel better. Like, okay, good. Now I'm going to solve the problem. Well, I hate to tell you, but 9 times out of 10, your animal is going to get better. Like when my cats, if they get an abscess, my barn cats, they get, sometimes they go after each other. Or sometimes, they tussle with somebody. I don't get them very often, but every once in a while we get an abscess. I'm like, okay, the abscess opens, the abscess drains, the cat licks the wound. I put some herbal salve on it. We don't go to antibiotics. The only way I would, even for a cat abscess, they'll have a very high fever and they'll feel like poo until the abscess ruptures. So either we lance the abscess and let it drain, and then within 12 hours, the temperature is going to be back to normal. They're going to be eating, they're going to be grooming and licking it. And looking back, all my years of practice, way overprescribed antibiotics for cats with abscesses. But, for a client with a cat and it depends on the abscess, but a cat with an abscess, you're like, oh, pus came out of there. I need antibiotics. I mean, Yeah, it is truly infected, but we could also just flush it. So, and then we get into all these animals with recurring skin infections because they have allergies, because their gut's screwed up, and because they're fed the wrong food. Like, take all the, this is not an allergy talk. But those animals are just chronically prescribed antibiotics to the point where then they develop MRSA, which is methicillin-resistant Staph aureus, which is an antibiotic-resistant infection.
And running rampant in American hospitals.
For
absolutely. Years now.
So then we need more antibiotics and stronger antibiotics and broader spectrum antibiotics. And, we get to the injectable antibiotics like the amikacin and the gentamicin, which are going to make them deaf and kill their kidneys because they've got sores on their skin. Well, we've got to fix the underlying problems. We've got to use things like microbubble baths and shampoos that are not wrecking the skin more. I mean, the microbiome has already been destroyed, and then we're throwing chlorhexidine and antibiotic shampoos and antifungal shampoos. And it's like, oh my God, we make it worse and worse.
It's like chemical on top of chemical on top of chemical. Yes. They totally break down the body's ability to heal itself and bring it back to homeostasis.
So, when AVMA says, oh yeah, probably 50% over prescription of antibiotics. Well, 2 of my animals went in and 100% of them were prescribed antibiotics. Oh, and so then Gabby, the little redhead, she had a bad tooth. And so she went in for a dental, and she had to have 4 extractions, and one of them was a big chewer that was infected. And miraculously, the nose problem cleared up once the infected tooth was gone. So there you go. So that's what was kind of holding things in place. But when I picked her up, they had the antibiotics ready. And I said, I'm not going to give them to her. Just take them off the bill and put them back on the shelf. Because AVMA has actually come out with studies, it's been printed in the journals, that even with infected teeth, and I have there's a great article where they did blood cultures on dogs before a dental, during the dental, and an hour after the dental with these dogs with really infected mouths that had a lot of extractions. And their blood cultures were negative going into the dental. They were positive in the middle of the dental, and within an hour cleared itself because the immune system was able to do its job. So we don't need antibiotics. Now, if you have a dog with an underlying other problem, like my mom she fell and now she has a fake shoulder and all kinds of hardware in her hip.
Wow.
And when she goes to the dentist just for a cleaning, her orthopedist says she will take antibiotics prior. Because the last thing we want is that prosthetic joint to, stuff gets in that bloodstream for that hour during the dental. We don't want to risk that it decides that it wants to lodge on, like if you have an artificial heart valve or an artificial joint. So not many of our dogs have artificial joints and artificial heart valves. I mean, maybe if you have one of those dogs that's gone to Japan for surgery to have mitral valve repair, maybe they're at higher risk. But every animal has to be looked at as an individual. So that's my dental thing. So now let's talk about the diarrhea and the metronidazole handed out like candy. Somebody just texted me earlier today. Their dog's not eating. Oh, yeah, we can talk about that too. Their dog's not eating. It's an old dog with cancer. The dog's not eating.
And it's got cancer?
Yeah. The vet prescribed Serenia in case it's nauseous. I'm like, okay, I can give you that. And metronidazole. I'm like, metronidazole for what? Like, what's that? If anything, that suppresses the appetite. It doesn't improve the appetite. So we've got major studies that have been in the AVMA journal showing that when we have dogs or cats that come in with diarrhea, even if it's bloody red colitis diarrhea, they've taken some and they've just treated them with probiotics and high fiber. And then they took others and they treated them with metronidazole and a bland diet. Guess who recovered faster and 30 days later had a normal microbiome versus the one whose microbiome was still a crap show a month later? Metronidazole should not be handed out for cases of diarrhea.
Let me read some of the warnings. I've got its little sheet right here. Central and peripheral nervous system effects, convulsive seizures, encephalopathy. I'm going to say shit wrong. Aseptic meningitis. These are the warnings on, this is Flagyl I'm reading right now.
That's
so
metronidazole.
I might be wrong. Yeah, I know it's metronidazole. I didn't know if it was the same brand. Optic and peripheral neuropathy. The latter characterized mainly by numbness or paresthesia. I gotta wear my glasses. Paresthesia of extremity. What is that? Paralyzed?
Yeah.
Like a arm or leg going numb?
Tingling, that kind of thing.
Yeah, have been reported in patients treated with metronidazole. The appearance of abnormal neurological signs demands the prompt discontinuation. And this is what's crazy is that, people will come, I'm sure to you like them all the time, me all the time, and go, I'm feeding the right diet, I'm giving the natural supplements, and then I have to do the deep dive. Have you been to the vet lately? Have you been diagnosed with anything? What did they give you? What is the age of your dog? And then they'll go, yeah, I think some antibiotics. And I'm like, there you go. And then we always can almost put the date back to that's when whatever the problem started. But what's really damaging, I think, about these antibiotics is that they do save lives. They do help when they're being used in the right way. But when they're being used in the wrong way and you don't get the support to rebuild the gut microbiome, like even in that case where you gave me the two cases, even if we gave the metronidazole and then followed it by doing the holistic route, we would be better off. Because they kill everything in the gut microbiome and we have to rebuild it.
And it's not only killing what's in the gut microbiome, it's killing the skin microbiome. It's killing everything. Like it's not like you give an antibiotic and it says, hey, I'm just going to go cure that cat abscess. I'll leave the gut alone. I'll leave the skin alone. It doesn't work that way. It kills everything off. So now we've got potential for skin infection. So one of my little dogs ate a sock, unbeknownst to me, a little 10-pounder, and ended up, it took 3 ultrasounds and taking her to the University of Pennsylvania to figure out that that's what the problem was. Like,
oh my gosh,
I couldn't figure it out. But was stuck right outside of her stomach in her upper small bowel, which is a really bad place. But she ended up she had to have a feeding tube put in. She ended up losing about a third of her small intestine. She was in ICU for 11 days. She had 3 plasma transfusions a day while she was there. Like, she was my little miracle dog. But when they took the feeding tube out, of course, from being in ICU, she had a really, really horrible resistant bacteria around that feeding tube entry. No shock. We've been in the ICU for 11 days. So they literally gave her one of the antibiotics was Bactriol, which is a fluoroquinolone. One was it might have been Clavamox was the second one. And I think metronidazole was the third. So this little 10-pound dog, and all of them, they had upped the doses so it was enough for like a 200-pound dog. They're like, we need really high doses. It's going to be an extended, protracted period that you're going to need to give these antibiotics for like the next 6 weeks. And I went, oh my.
I feel like she'd be dead after 6 weeks of that.
I thought she'd be dead after 2 days of that. So I took her home and I got out my herbal wound paste and slapped that on that opening in her side, and it healed beautifully. And we didn't have to use all those antibiotics. And, it's just,
wow.
Sometimes we don't give other things a chance. Now, and it's very easy for me to do this with my own dogs because I know what I'm watching for. I know I know what I'm looking at to say, oh, okay, this is not going well. We're kind of in trouble. We got to change course. But there's just so many other ways to do things. And we're getting to the point where we're all going to, those flesh-eating bacteria that people die from because there's no antibiotics that work against them. We don't all want to end up with that. We don't want to end up with that.
It's scary. I do want to talk about, because I see the new trend of going, okay, I did the antibiotics, but they did give me FortiFlora. And I just want to describe to people, because also why I'm pissed off is, I don't know if this is happening to you, I'm starting to see FortiFlora ads on social media. And I'm like, so what they're doing is they're jumping on that. Everybody knows about probiotics now. So they're jumping on that bandwagon of giving it every day.
That's probably the worst probiotic And veterinarians hand that out like candy. Oh, you can't hurt them with that. Really?
Yep.
Yeah. Oh, God.
So let's talk about that for a minute, because I don't think people understand what the problem is with it. Not only is it filled with synthetic ingredients like synthetic vitamin C, synthetic vitamin E, which can acidify the gut and cause diarrhea, which makes no sense because that's what you're literally taking it for. Of course, kidney issues. Synthetic vitamin E is poorly absorbed. It can interfere with blood clotting. Iron, so they've got synthetic iron and synthetic copper in it, which can be toxic in excess. So giving it to a dog for 6 weeks, I think, would absolutely turn into a toxic situation. Sodium selenate. And then I don't even know what's the name of the one. They have one strain in there. I think that starts with an E. I was like, what is this one? But it literally causes an overgrowth of that one strain and wrecks the gut. So you have taken an antibiotic, which has completely destroyed the bad guys and all of the good guys, especially if they're taking it long term. And then they've reintroduced one with all of these synthetic chemicals.
My biggest issue with it is the animal digest. That is the base to make it taste good and make them eat it. That's a rendered product. The chances of it having euthanasia solution in it are 100%. Nasty, nasty stuff. And it can come from any animal. It's called animal digest, which means it can be from any animal. It is the rendered leftover
crap that's left over.
Yuck. And it's been dried out to make this powder, but it tastes good to our pets. You know, candy tastes great to my 4-year-old granddaughter. That doesn't mean she gets to eat it every hour.
Right. Exactly. Let's talk about some of your natural things that you love. That's what I love too, is being able to take what exists in nature, and that different ones are good for different things. So what are your favorite go-tos? Let's say somebody's got diarrhea for, day 2. You're like, all right, I got to step in and see what this is. What do you do?
So I usually give them, first of all, I figure out if it's a cold diarrhea or a hot diarrhea. And then I use one of my bland recipes based on the energetics of what we have going on. I mean, if it's got blood and mucus in it, it's a hot diarrhea. So we've got to give something cooling. And so I think my cooling recipe is ground turkey. It's got mushrooms in it because mushrooms are so good for everything, but really good for the gut.
So good for the gut.
And it has pumpkin. I think it has peppermint in it for my hot diarrhea because that's a cooling, good herb. And then for the cold diarrheas, we've got to warm them up. So they get pumpkin and ginger and something more warming, venison or chicken, and the mushrooms again. So I've got recipes. So that's the first thing we're going to do. We're going to give something. And these, as much as I love raw food, when we've got a diarrhea issue, we need something that's basically pre-digested. So it's going to be something that is gently cooked. I love to take these recipes, put them in the slow cooker, and cook them on low heat for about 6 hours. And then I actually take an immersion blender and make it into basically soup, a thick soup, because that's pre-digested and the gut's just like, oh, thank you so much. I didn't feel like working. If you have none of that available, scrambled eggs are great. If you have mushrooms to add to it, that's even better. So we do that. We have herbs. My favorite herb for a hot diarrhea is Coptis. It works so well. As a matter of fact, we have studies showing comparing Coptis to metronidazole, and it actually works better than metronidazole in people.
Awesome. How do you spell Coptis? Coptis?
Coptis. Yeah.
And is it something we can get on your site?
Yep.
Okay, awesome.
Yeah, you can get it on Amazon. You can get it anywhere. So I love Coptis for the diarrheas, for the hot diarrheas. We use a different herb for cold diarrhea. Cold diarrhea is going to be the one with the undigested food. It's usually the old animals that just aren't digesting well anymore. They're too cold. So we warm them up. The herb I like for that is usually Shenling Baiju. It's also on the website. So we just went through a very long cold spell in North Carolina, which is unusual. And one of our mini horses, Lucky, my mom's little white one, she's 27, and she developed, the veterinarian calls it cecal water syndrome. I called it cold winter diarrhea. So basically, she's not digesting the hay. And so she would have normal manure, but then liquid that would come with it. because stuff was not breaking down well enough in her large intestine. So we had to buy a special hay, a chopped hay. So it's basically looks more like lawnmower clippings. And she was like, well, the hay lady, when I called to ask for her, she said, man, I hate getting that stuff. It's such a mess because it doesn't bale very well because,
Right.
two strings aren't going to hold a bunch of lawnmower clippings together. So it ended up, they got it in for me and it all fell apart. So they had it in these big black trash bags for me, which was fine. But I did that along with the Shenling Baiju and built a stall for her and kept her inside with her little buddy at night so that they could eat their own special hay. They were warmer and she was getting her herb. Oh, and then I also used BioSponge, and 2 days solved the problem.
And the hay thing is the same concept. You're pre-digesting or
the food. Exactly. So,
cool.
And as soon as it warmed up, now it's 87 here today. Next week is going to be back in the 30s.
What is going on? That's crazy.
Yeah, it's crazy. So, she's doing great. She's back on the regular hay and doing fine. So we have to look at the type of diarrhea, and then we have to look at how are we going to solve this problem. So, and then, if they've got that upset stomach and a lot of inflammation going on, I love things like slippery elm and marshmallow and, all the herbs that we have that are so good. I am a huge fan of montmorillonite or bentonite clay for helping put a cork in things. Interestingly, I have not started using peptides for our animals yet, but I think we really need to be looking at peptides. My naturopath uses a ton of peptides for my husband and I. And so my husband, after when about halfway through our trip to Italy, he developed some significant GI issues. And so when we got home, he got tested and no bacteria, nothing that was out of whack. So we're like, okay, well, something in your system just reset. So we put him on this peptide, BP157, and he has to dissolve a capsule in a glass of water and drink that and then swallow a capsule whole. And he's been doing that for a few weeks, and it's much better just with a peptide. So I think there's so many things out there that we can do, that we can use, that we don't even know.
Or we do know, it's just being kept from us or suppressed, and our doctors certainly aren't being taught it. So that's why you and I are here to tell everyone about it. One of my favorite things is, of course, mushrooms also, both giving them extracts and actually feeding them. But one of my favorite pieces of information is that feeding 3 grams chopped up, cooked for about 25 minutes, feeding 3 grams of mushrooms feeds the gut microbiota for 13 days. Wow. So literally every 13 days, if you can eat them and feed 3 grams to your pet and to yourself, you've got your gut pretty much protected. And when I say that, literally, and you're taking a mushroom extract at the same time, when they do have to take an antibiotic or they come across a virus or a bacteria, the mushrooms literally train your cells how to remove bad mushrooms, mycotoxins, viruses, bacteria out of the body. So it doesn't even affect you. So eat them every 13 days because they're amazing. Take their extracts, everybody. It is amazing. So that you maybe don't even have to you have one day maybe of some green mucus, and by day 2, it's cleared up. I just had a wonderful, one of the things I always go to, and it was the first antibiotic, is silver hydrosol. Like silver hydrosol and a full spectrum hemp extract and my mushroom extracts were literally like on a tool belt when I was walking around my rescue and farm. Just treated my friend's old dog who was like getting mucusy here and then in on his penis. And I was like, all right, we got to go get some silver hydrosol. Got that in the eye, cleared it up in 2 days. And I'm like, okay, this is going to here. And then he's licking that. Let's work on that next. But yeah, they shouldn't be handed out like candy because they have very harsh side effects, both from what the antibiotic does and it's in your body and the other ingredients in there. Really sets your body off. So yeah, ditch those crappy probiotics. Feed the gut, right? Yeah. Feed the gut those mushrooms and wonderful things.
Yeah. And I mean, if you want something that is going to have a much broader spectrum, rather than just giving something that has a couple of strains of probiotics in it, fermented foods are, you're going to find thousands of strains in a fermented food. So you could keep some kimchi around or fermented goat milk or whatever your fermentation product is of choice. And then the other thing that you can do is the FMT, the fecal microbiota transplant, especially if they've had, multiple courses of antibiotics or metronidazole. We've got to fix the gut. And we did we posted it a few weeks ago, but we did an interesting study with my little Gabby because she's never had stool issues at all. So we sent her stool out and did her microflora evaluation. And it came back looking really nice. She was a little low on fungal elements, but the thing that stuck out was that she had some antibiotic-resistant bacteria that showed up in that sample. And I'm like, oh, she's never had a problem. And she, doesn't get antibiotics. Although I got her when she was 4. So that was 5 years ago. Has she had anything before that? I don't know. So then I gave her a month of FMT, the Legacy Biome. And so 1 capsule a day. It was really easy to do. And then we rechecked. Really interesting. Her diversity was still amazing, but her fungal diversity now showed up and was great. And all of the antibiotic-resistant bacteria went away.
Awesome. Without the need of an antibiotic.
Without the need of anything.
Well, Sac B, right? That's what, I don't know how to say the whole name.
The Saccharomyces Boulardii. Yeah, so that's a fungal element. So if your dog or cat does have to, or you have to take antibiotics, take Saccharomyces while on the antibiotic. Taking probiotics while you're on the antibiotic, you can, it might help, but you take the probiotic and then you take the antibiotic, you just killed it all anyway. But it won't kill the Saccharomyces because that's a fungal element. So, I recommend if your animal's on antibiotics, use the Saccharomyces while they're on it. And then when they finish the antibiotics, then we can start adding in our probiotics, whether that's fermented foods or, your favorite probiotic product that's not FortiFlora.
So can't we try Sac B before we go to the antibiotic though? Because won't Sac B kill the bad bacteria or the antibiotic resistant bacteria?
Probably not. Although
do we need to run a piece of research?
Yeah, that's an interesting thing. I guess I need to take another one of my dogs and and do that again and just use Saccharomyces and see if it changes anything.
But let's talk about those additives, because before the show, I told you I'm doing a deep dive on these additives that are put in our natural supplements and found in food. And we think it is a great diet or a great medicine, but they put these other ingredients in it. And I've come to the conclusion that if there is a binder or filler or flavoring or dye in that supplement, just say no, because it doesn't need to be in there. The only thing that needs to be in there is a preservative.
That's why a lot of products don't make it onto Dr. Judy, because the first thing I look at is the inactive ingredients. I care about that more because it's like, on the label, it says, oh, it's got curcumin and this and that. And, you're like, okay, that's all great. I mean, I'd like to know where it's sourced, so I'll look at that too. Right. But I want to know which is why we have very, very few, I don't even know if we have any right now, but we have very, very few soft chew treat type supplements.
And why I have never made one.
Because it's almost impossible. And I have someone who's after me to make some. And I'm like, I can't. Because you've got to put humectants in it and you've got to put more preservatives in it.
Otherwise, it'll just fall apart.
Yeah, you have powder. But, it's so easy. My dog takes it as a treat. That's great. But I can't do it without putting things in that I don't want in there. And are we being nitpicky about it? And, is it such a small amount that it really wouldn't make a difference? Well, it depends. If you have a dog with leaky gut, if you have a pet with chronic allergies, chronic IBD, every time you give them anything synthetic into their system, the body says, I don't recognize that. That's not something natural that I find in nature or that I normally would ingest. And the body reacts against it. So, how much, because we found the original PEA supplement that before we managed to source our own.
Oh, I remember us talking about this.
The original PEA was a capsule, and we still carry it. And my mom and you and I all take the capsule. I guess I could use our straight powder and mix it in something, but the capsule's easy. It's in our little bowl with our other 27 capsules every morning. But we had some dogs who, like allergy dogs, because PEA is great for allergies. And we had some that were getting more itchy. And we're like, that shouldn't happen. They should be better. Well, it has rice powder as a flow agent in the capsule to keep it from clumping, which I don't know why you care when it's in a capsule anyway. But it had rice powder as a flow agent. And so we had some of these really sensitive dogs who had grain allergies, and that little bit of rice powder in there was enough to send them over the edge. So, and rice is a natural ingredient. So is rice powder a big problem? Well, it's not really a binder. It's not really, they're using it as a flow agent. I get it.
So that's a filler. So I put flow agents into fillers because I had to divide it up because there's also thousands and thousands. So I tried to make a chart. I started a chart. I have about 100 on them and divide it between fillers and dyes and whatever because it's out of control. And guess what, folks? You think the FDA's got you covered on the humans. They don't. And on the pets, it doesn't matter. They consider our pets property. So they do whatever they want, and they do. Like even companies who make a human product who also make a pet product, their human product will be great. And then you look at the pet product and you'll turn it around and you're like, what the hell is that? Where did that come from? But it makes a huge difference. And the other thing that pisses me off is taking something like citric acid, right? Sounds good, right? Citric acid. It comes from citrus. It's natural. No, there's citric acid that comes from citrus, and then there's citric acid that comes from petroleum or from corn and soy. And you're like, wait a minute, but it's called citric acid. So even knowing where that natural thing sounds like inulin was another one. Well, what kind? Cellulose. Man, cellulose can be a million different things, and it can be an ultra processed, it could be a treated, or it can be an all natural. Same thing with glycerin. We've got glycerin from petroleum or corn or soy, or glycerin from an organic coconut or flax, or I don't know, those are the ones I use. I know there's others. So we got to really read those ingredients. And I don't know, I feel like I overwhelm pet parents and they feel so overwhelmed. I mean, I literally had someone yesterday going, what? When did this happen? And I'm like, I don't know. I just found it on their label too. And getting so disheartened, but we have to. And those people who do take the time, like Judy does, to get the good products, to do the vetting, and these brands that do go through the extra steps to make a perfect product that is all natural and doesn't have anything bad in it, we don't want them to disappear because it ain't easy what they do. These food companies and other supplement companies who source from farmers who are small and growing what they do best, and the extractors who do what they do best, and the mushroom foragers and the people who are growing it the right way on wood. That's the hard way, guys, but that's the way it's supposed to be done. And just say no to these synthetic additives that don't need to be in your supplements, and just say no to frickin' antibiotics. Be prepared. Prepare. If you have to do it, prepare your gut before and after.
I mean, they definitely have a place. Before we had penicillin, we had big problems. So they definitely have a place. So here's another one. This one made me cry. I have a good friend, lives in a country in Europe, and she has a Cavalier, and the dog is almost 15. And nice. This just beautiful dog. She went in January because when she lived in the States, her groomer would check the anal glands, and the groomers over there won't do that. So she takes the dog to the vet to have them checked on occasion. So she went in January, the left gland expressed, the right gland didn't, and it was hard. And so the vet said, I can't get that one to express. So I'm going to put her on a month of steroids and antibiotics. Come back in a month and we'll check the gland again. Went back in a month, still a hard gland that would not express. Left one expressed fine. Another month of steroids and antibiotics. So we go back for the third recheck, still the same. So they did a scan, I guess a CT, and it's an anal gland adenocarcinoma that has spread to the lymph nodes. And, I didn't want to make the owner feel bad, so I kept my mouth shut, but I was like, if the veterinarian had done the right thing, first of all, anal gland adenocarcinomas, when you feel them, they're kind of obvious. So that was kind of maddening. But we wasted 2 months. We let that cancer spread. And we gave things that screwed up the immune system and didn't allow the dog to fight it. And so, I mean, the owner was wonderful. And she contacted me. And she used to bring her dogs to me when she lived in the States. And she said, I'm not going to put her, we can't do surgery now. It's in the lymph nodes, and certainly not going to put her through chemo, radiation. This dog loves life. This dog, they're up north in the UK, and this dog like runs through the ocean when it's 10 degrees outside. She's just so full of life. She's so happy. And they travel a lot and they take her everywhere. So, and of course the diet that she was on isn't horrible, but it has potatoes in it. So I took my time and made a whole protocol for her. And I said, can you get CBD in your country? Because some countries allow it and some don't. And she said, yes, I can. And I'm like, all right, that's part of the protocol. We're going, and then I said, these are the mushrooms I want you to get. And she actually was able to get them over there.
Awesome.
And then we found a food that was very similar to what I feed my dogs. So I was like, okay, we can go with that. So we had to go through finding all of the herbs and things. I put her on 3 different Chinese herbal formulas, and she was able to source all of those. So, when we're dealing with people in another country, part of it is being able to get what we need to get. Right. And so the whole goal with this dog is not to cure the cancer. The goal is to stabilize it and allow her immune system to come back. Amen. And keep it at bay so that, maybe she lives to 17. Like my little George, who had bladder cancer, I found it at 15 and he died at 17, and he didn't die from the cancer. Nope. So it's like, okay. I mean, that's the goal, just to keep them comfortable.
Right. And people need to understand we've got cancer cells in us right now. It's our body. If we're feeding our body and keeping our immune system healthy, it's what's keeping it from taking over. And even if our immune system gets slow or we get older or whatever it is, we have everything in nature like hemp and mushrooms and Chinese herbs to literally help our body fight it and get it out. But what happens, and I feel like every single week now, I'm getting an email from a pet parent whose dog has been diagnosed with osteosarcoma. And they go, should I get it biopsied? Should I get it amputated? They're not sure it's osteosarcoma. I'm like, it's a Doberman. It's 8. It's osteosarcoma. Do not get a biopsy. You do not have to amputate. Here's what I did. But what people don't understand is just making that simple mistake of wasting 3 weeks and giving them something that does not help and is taking away the body's ability to help them. And that's what breaks my heart too.
That overprescription of antibiotics. There was absolutely no evidence that dog needed an antibiotic. And no evidence that the dog needed a steroid.
Would you agree with me? Because I already know I lost Lucy from giving her antibiotics and steroids for over a year. That's how I lost my first dog. I killed my first dog by doing that exact thing. They couldn't figure out what was wrong with her. Well, what was wrong with her is that I was doing everything that a conventional vet suggested that I did, and I followed it blindly. That's what happened. So I have always been outspoken about antibiotics and steroids. But that's what makes me upset and so passionate about having this conversation with you, is that those of us that know better, that go, okay, I'm not doing that. I've listened to Dr. Judy, so I'm going to go find the hemp, the mushrooms, the Chinese herbs, the food or whatever. And in those things are those hidden ingredients that are still causing harm. Also, we already know, and tell me if you agree with this, we know that this overprescribing of antibiotics and steroids is happening both in human and animal, but the same thing is happening with all of the drugs, all of them. Yeah. Pain medications, the allergy medications, and they're all so dangerous on their own. They're all supposed to be used in emergency, temporary situations, not lifelong, and they are.
Oh, exactly.
The person goes, oh my God, antibiotics saved my dog's life. Antibiotics and steroids saved my dog's life. Okay, well, it's 9 months later and you're on the phone with me wondering what's wrong with your dog. And it's because what you did 9 months ago, we never fixed the gut.
Yeah. I mean, again, antibiotics in the right situation, save lives. Steroids in the right situation, immune-mediated hemolytic anemia, immune-mediated thrombocytopenia. If their body is killing itself, we need to shut it down.
Right.
But we need to shut it down short term.
Yep.
And then we need to build the body back up and allow it to heal itself. So, I get these emails and messages from people who are like, oh, my dog's been on this high dose of steroids for 3 years. He doesn't have any muscle left. He's got pot belly. He's drinking and urinating. Yeah, well, now he has Cushing's. That's great. And it's like, well, how do I get him off of it? Well, it's been on for 3 years. We can't stop today. A lot of things are used wrong. Like we get dogs with a little bit of runny eyes, sneezing, because, right now the pollen here is 2 inches thick on everything. And it's like, oh, here, give them Apoquel. Well, why? We're going to kill his immune system and suppress his immune system, and then they get stuck on
and not take care of the problem.
And we can't do a whole lot about the pollen right now. We're hoping for some rain soon. Wash it away. But it is what it is. And it's like, okay, so we put up with, sneezing and runny eyes and a little bit of itching for this very short window. Yes, there are herbs we can use. There are things we can use to calm down the immune system without killing it off. So, there's just so many things that can be done instead. And like one of my new ones that makes me nuts is Librela, which is the monoclonal antibody injection for arthritis.
Like, did we really need another arthritis drug? Did we really need something else for pain?
We sure did not need this one because it kills animals. But I have people who email me and say, well, I went in because my dog is limping and he's got Lyme disease. And the vet said, well, he's probably got arthritis too, so we'll give him a Librela shot. And I'm like, it's not labeled for use in Lyme disease and swollen inflamed joints. It's labeled for arthritis, but I still wouldn't use it. I don't care if I had to carry my dog every step every day. He'd be in a 4-wheeled cart. I would not be. Right. I would never give that drug. Never.
All right. Well, I guess we have to wrap up, or we'll talk all day. And I don't want to, get into your jacuzzi time. I wish I could meet you. We could just continue to bitch with our martinis in the jacuzzi. Thank you so much for having a rant with me. I really enjoy it. It's nice to talk to someone who can be so honest.
I have no filter, Angela. You know that.
Yep.
Well, so you don't either. That's why we get along.
That's right. Life's too short. Whatever. Call me what you want. I don't care. I'm going to keep on speaking the truth and sharing what I know, because I know everybody's really busy and it'd be really nice to trust the person in the white coat, but we can't. We know better. We have to do our homework. We have to do our research, and we have to read those labels, and always read those labels, because companies get bought and they change. Sometimes just 2 or 3 ingredients. Or another thing that's happening, if there's a supplement coming from overseas and the tariffs, oftentimes ingredients will have an impact because they have to make up for that somehow. So keep reading them. Make sure nothing changes, because you are your pet's best advocate. Judy, Thank you so much. We'll have tons of links to Judy's products. I know she has a whole antibiotic page of natural things, all kinds of stuff, and amazing blogs on talking about more about this subject. Thank you, Judy.
Thank you.
Thanks for listening to today's episode. Please make sure to leave us a review wherever you're listening from. This is the best way to help pet parents like you find these episodes and get access to all our content. Follow me on Facebook and Instagram at Your Natural Dog and at AngelaArdolino.com.